Hello, I'm Dr. Michael Chang, and I am an adult and pediatric deformity spine surgeon at Sonoran Spine Center. Here today to talk to you about a condition called Scheuermann's kyphosis. And actually, we have a patient, Kaila, who came to us with this problem. She's a 17-year-old girl, and this problem, which is otherwise known as hunchbacking, has been bothering her for quite some time. Now, hunchbacking usually starts occurring in many children around the teenage years, and for the most part, it does not require any treatment other than potentially anti-inflammatories or physical therapy if they have some back pain. However, it is unfortunate that some teenagers get a version where it is progressive, that is to say, the curve gets worse and worse with time. And this is the case for Kaila, who is now 17 years. Despite being 17, and we would have expected the curve to have stopped getting worse on its own, it is still steadily worsening and giving her ever-increasing amounts of pain. So now she is going to go forward with a surgical procedure in order to correct this problem. I have here a model that shows how we go about correcting this. This model is actually a little bit more complex than the actual surgery that we do, but in general, it helps us to illustrate the fact that we put screws in the spine and then connect rods, two rods, in the front and back. And by contouring the rods to the shape we want the spine to be in, we can reshape the spine and take a lot of the hunchbacking out. And that's what we plan on doing for Kaila. So here we can see Kaila's x-rays. This is a front view, and she looks pretty good from the front view, completely straight. And this is a side view. And what you can see here is the spine is normally slightly S-shaped from a side view, but in her case, she has a significant hunching. This is over 70 degrees through the thoracic, or what we otherwise know as the chest portion of the spine. And it's particularly focused in one region in the middle portion of the thoracic spine. So we'll fix this by cutting little bony wedges out of the back portion of her spine and then putting the screws in the rods, and that will help us straighten out her entire hunchback. I would expect that she's going to have an excellent result from the surgery. We're going to be able to completely recontour her spine so it has the normal shape and appearance that we would expect most teenagers to have. It will help take away her chest pain that she has in the back part of her body. And at the same time, it will not actually cause any functional limitation. Despite the fact that we'll be fusing the chest portion of the spine, it does not move much to begin with, and so she will ultimately, 6 months to a year out, be able to participate fully in sports, even on a competitive level, without any restrictions.
Hi, my name is Kaila, and I was 12 years old when I was diagnosed with Scheuermann's disease. Scheuermann's disease is when I was growing up, my vertebrae developed wedge shape, which punches me forward. Growing up, it was quite a challenge because teachers and family members and even friends would tell me to sit up straight and to be a lady. And I would try as hard as I can to do that, but for some reason it just seemed so difficult to. When I was diagnosed, that's when I learned that I had a disease. That disease is something I had to deal with. There have been many challenges in life. Just doing simple everyday tasks and everything have been a challenge. Back in March of this year, 2014, I got my black belt, and that was a challenge, one of the hardest challenges of my whole life. I struggled punching and kicking, doing simple things that every other person could do and every other teenager could do except for myself. And overcoming that challenge has been a great thing of mine. I came to Dr. Chang because he was recommended to us by a family friend. He made me feel super safe and made me feel super comfortable with having this surgery. He made me feel like he had no problem doing the surgery and that it would keep me upright, reduce 90% of my pain, and get me back to doing what I love to do within 6 to 12 months' time. It was a great miracle, and I'm so happy. Throughout the past 5 years, we've tried so many things to help fix my back. We've tried bracing, physical therapy and rehab, and numerous doctor's appointments to show us how to properly stretch and things that can alleviate pain for my back. None of which have worked at all. Nothing. And that's when we decided it was time for surgery. Knowing the surgery will bring pain level 90% better, it'll be phenomenal. Bracing didn't do anything except just be uncomfortable. Physical therapy would make me so sore the next day, and I would feel absolutely not better at all. So that's when we decided it was time for surgery. My thoughts leading up to the surgery were, I hope this doctor doesn't tell me, well, just, take some Advil and you'll be fine. But no, Dr. Chang was thorough and he really genuinely cared. He showed me that surgery would go just as planned and how beneficial a surgery could actually be. And it was such a relief to know someone and be with someone who genuinely cared about my back and genuinely cared about the progress and seeing my journey through my spine surgery and caring about how I ended up. And I hadn't felt like that from any other doctor. So it was a great, great thing. As like any person going into surgery, I do have fears and hopes and expectations for this. Of course, my fears are, what if something goes wrong? What if I wake up and it doesn't work right, But I know Dr. Chang's going to do an excellent job, and my expectation is when not only being 3 inches taller, of course, after the surgery, but being mostly pain-free, up to 90% of that pain reduced, and being able to go back to the sport I love and doing the things I love to do, and being able to even just go up a flight of stairs without being in pain. I'm really excited for it. What I'm most looking forward to after surgery and in my recovery stage, I'm looking forward to being able to run, jog, go to the gym, go upstairs, everything. Most thing I'm looking forward to is being able to sit up tall and being able to bend over without my back looking all arched and being more confident in who I am and what I've been through and what I have to look forward to. I'm really excited for the surgery. I'm 3 weeks out right now. Couldn't come faster, but I'm genuinely excited. So it's been a pretty rough week. We went on a car ride to Payson and it was just agony. Sitting in the back seat, just trying to sit and be, and there it is, half hour into the trip, and I have to move, get up, we have to pull over so I can stretch. It's pretty bad. This week's been, back pain wise, pretty awful, but I'm 12 days out from surgery as of today, and tomorrow's my pre-op appointment, 11 days before my surgery, and pretty nervous about it. Get to see Dr. Chang. Can't wait to ask him the questions that I've been longing to know the answers to. I'm excited to know how long till I'll be able to walk. Are they going to get me walking right away? When can I start going back to physical activity, doing the sports, gym, even just walking on a treadmill? I'm excited to know exactly the specific details of the surgery. I want to know how they're going to do the surgery, how does it work? Of course, since it's my back, I'm going to want to know exactly how everything's going to go. So I'm excited to hear that. I'm excited to get it done, It's a week from this upcoming Tuesday, and today is Thursday. So it's pretty close, it snuck up on me. I remember hearing back in May, I'm like, oh, it's in August. It's a while away. I'm good. And then next thing you know, it's 2 weeks from Tuesday, and here we are. I'm like, oh man, so close. But next Tuesday, I get to go for my hospital tour, exactly 1 week before my surgery. I can see where I'm going to be staying at the Scottsdale North Shea Hospital, and I get to see everything where I'll be staying, where my family's going to be able to stay. So that's pretty exciting. And once again, get to see Dr. Chang tomorrow. I know he'll be reassuring, which is actually really awesome. I know everyone's so nervous about it. My mom, my dad, everyone's talking about how nervous they are. I'm like, I want someone just who's going to be able to comfort me and tell me everything's going to be okay. And I know that he can offer that, so.
So this appointment is just to go over with you what to be doing before surgery, after surgery, and go over all questions you guys have, okay? So this is just going over the surgery date with you. The hospital when to arrive. We don't want you to eat or drink anything after midnight the night before, okay? Your first appointment will be 6 weeks out from surgery. And you can schedule that with myself or Dr. Chang, either one of us, okay? You can make that appointment today, or you can call us back and make that appointment. use the general rule of if your incision is draining, I want you to cover it, okay? But if it's not draining and it's dry, then keep it open to the air. You can wear a loose fitting t-shirt. Your bra strap might be a little bit uncomfortable because it will go over that incision, so if you just wear a loose fitting t-shirt, that will probably be the most comfortable for you, okay? You'll have a bandage on throughout your hospital stay though, and they'll most likely take it off when you go home. Okay, so only if it's draining will you need to cover it.
How long will I planning to be at the hospital?
Probably for 3 or 4 days. Yeah. Okay. So there's always a chance of infection with any surgery. If you notice any drainage coming from the site, which is yellow, green, even brown, thick drainage, you might have an infection. If you notice any fever shows night sweats, you have to make sure to call us and we'll get you in for an appointment, okay? You'll be able to shower as soon as you get home from the hospital. We use this glue-like substance in surgery to cover the incision, so it protects the incision from any water. You cannot bathe or submerge in water though, up until 6 weeks out from surgery, so no pool, no submerging, but a shower is okay. All right. Activities, I only want you walking the first 6 weeks after surgery. No physical therapy is going to be needed. During your hospital stay, you'll get physical therapy, but no outpatient physical therapy. No going to the gym, no running, no lifting weights, nothing like that. Okay? Do you work?
I'm not right now.
Okay. Constipation is the #1 side effect of the pain medications that we'll be giving you after surgery. So we'll give you some medication to help with that process, okay? You cannot drive while taking those narcotic pain medications. Once you're off them, there's really no issues of you driving 2-3 weeks after surgery, okay? But your parents will probably be driving you a lot, okay? We can skip this one. Exercising, we will, again, no exercising for the first 6 weeks, okay? Just walking.
Regarding your shower,
Yes.
should she try not to have it, like, you know how you sit in the shower and have the water beat down on her back? Should she try not to do that?
Yeah, the front-facing shower
Yeah.
is the best way for you, and then to wash your hair, you can kind of get under there, and then the water can
Drip down.
just drip down,
Yeah.
okay? And then you don't need to scrub the incision. If mom wants to just, scrub around and then you can just pour water over it, that should be fine. Okay.
What were the other questions?
What is the best way, if there's an infection, is it caused from something happening inside her body, or is it something that we can help?
Prevent.
Yeah.
There's nothing that you can do to help prevent, except still stay relatively clean.
Right.
I don't want you rolling in the mud or anything.
Yeah.
But we will be giving large doses of antibiotics during surgery. We're going to be giving you IV antibiotics after surgery, okay? So you'll have a Foley catheter in your bladder for the first couple days after surgery.
She was asking me about that,
I
and
was
I
just
said
asking that.
they probably will give you a catheter, but
Yes.
they'll do that maybe after she's.
Yes, while you're sleeping
So, because she was worried about that.
is when we insert it, okay? And then we'll need to keep it a couple days because you won't be ambulatory, especially the day of surgery and the day.
When are they going to first have me walking, and then
The
what's
day
gonna
after.
be the walking? How much should I be doing for how much time before?
Sure. So the day after surgery, they're gonna try and get you at least standing, okay, next to your bed. If you can take a couple of steps to get into a chair or something like that, then that will be great. And then each day you'll progress a little bit more. They'll be walking you down the hallway, things like that. And then it's just, there's no right or wrong length of walking. When you're home, if you can go around, the bedroom, go to the kitchen, make it to the bathroom, and then weeks down the road, you'll be able to walk outside longer distance. Well, not in this heat, but maybe, you'll be able to walk without the walker in your home without much difficulty. So there's no set rule of how many feet you should be walking.
And when will I be able to get back into just going to the gym and walking on the treadmill, or just weaning into that?
If you're just walking on the treadmill, you can do that when you get home.
When can I start doing more physical activity?
Well, after the 6 weeks,
Yeah.
for sure.
In 6 weeks, you'll be able to do a lot more. You'll be able to, you can jog at that point, you can lift light weights, things like that.
Is it going to be something where, I don't know how long it'll be till sports, is that just something you kind of play by ear, how you're feeling? Or
Yeah,
is there a certain...
it depends what kind of sports. No contact sports until 3 months out. You can swim at 6 weeks though.
Oh wow.
And she loves to swim.
So you can get in the water at 6 weeks.
But she does
submerge?
Taekwondo,
And
so.
submerge. Oh, that's right. I remember. Yes.
That's contact. Well, I mean, if you don't do the actual fighting part of it,
Right.
you can do the,
I think I would
because
feel
kicking is...
more comfortable maybe 4 or 5 months in surgery.
And even if
That's what we were
yeah.
told originally, 4 to 5,
Even
6
if it's
months.
longer, she's getting.
So we're going to be starting at T4 or T5 in your spine. So that's up here somewhere, okay? And then we're going to L2, which is about mid-back.
Is that how long the incision's going to be?
Yeah. And what we're going to be doing is putting pedicle screws into every vertebra. So there's going to be 2 screws per level, okay?
On every single one?
On every single one.
Okay.
And then we're going to connect the screws with 2 rods on either side. So you're going to have a lot of screws and only 2 rods, okay? Your issue is you have...
Those rods are just on the ones you said?
Mm-hmm. And your issue is you have something called kyphosis. And in order to fix that curvature in your spine, we're going to take little itty bitty cuts at a couple different levels in your spine in order to flex your spine a little bit to make it more flexible so that we can take that curve out of your back. And then we will put in bone that we took away already from your spine. Okay, we put it back into your spine, around it, and that's what makes the fusion mass. Okay, that's what causes you to fuse in that way.
Yeah, sometimes they have to do grafts from other places, right?
Yep,
Oh.
we don't do that. So
Okay.
we won't be taking it from other sites in your body.
Yeah.
Should I be laying down most of the days or sitting up?
Either. We don't want you immobile, so I don't want you just lying in bed.
How much should I be moving a day? Once I get home that Friday or Saturday, how much should I be moving per day?
As comfortable, like I said, I want you to get up, obviously go to the bathrooms. If you can go to the kitchen to eat for meals instead of having the meals come to you, you're going to be sore, but as comfortable. So getting up frequently during the day, and that's determined by you. Okay, there's no set rule.
Oh, that's the question I was going to ask. After when I get home, what's physical therapy? Am I still going to be continuing physical therapy, and where?
We will not need physical therapy for right after surgery for the first 6 weeks.
When should I go to?
We don't necessarily have to start you back. If you have issues at your 6-week post-op visit, a lot of the time patients complain of scapular pain, so pain around their shoulder blades. If that's a pain that continues and we can't really seem to get rid of it, we'll start doing therapy, things like that. But okay,
So I'll definitely be able to start school in January.
definitely.
Well, tomorrow's my surgery. Can't believe it's finally here. It's crazy. We have to be there at 5:30 in the morning, and surgery is planned for 7:30. So, it's 5-6 hours long surgery, and that's it. I'll wake up and see how it is. See my recovery process, and I know we'll be taking lots of pictures and footage, and I'm pretty excited and nervous. The nerves are kicking in right now. But I have all my friends and family here, and we're all getting ready for the big day tomorrow. It's exciting. We'll see how it goes.
Ready to get this done? All right. Any questions at all for me? Okay. If you wouldn't mind sitting up, I just have to mark your back. There you go. That's your ticket in. And just wanted to make sure you don't have any leg problems or anything like that. Haven't involved that. Still just pain in kind of like the mid-back region, right through here. Is that correct? Okay. Well, the surgery itself will be pretty quick. It'll take about 3 to 3.5 hours to do, but that does not include an hour and a half it takes to put you to sleep and wake you up. Okay, so if you calculate all that time in, it's about 5 hours total. From the time you go back, if you go back at 7:30, it'll be about noon, 12:30ish that I'll come out and say hi to you. All right? Okay. Good. I'll see you very shortly then, all right?
It's about 4 hours after my surgery, and Dr. Chang just came in and he showed me some pictures he took during the actual surgery of my spine, and I got to see my spine and all the screws that they put in. And I got to see the actual x-ray, which shows all the screws that he put in. He said he put in 20 screws, and I'm feeling okay. Feeling pretty good. So, we'll see how tomorrow is. Or do I walk?
Go ahead. Take those steps. Tell him it's your second day after surgery, and
It's Kayla's first
you had
step.
a rough day, but you're doing it.
You are. Look at your family. Keep looking up.
Keep looking up at us.
Good.
Oh,
now she's like,
I gotta get out of the way.
look out, people.
You going home?
Don't show her where the exits are.
Speed racer over here.
My whole bum hanging out.
No, we got it covered. You're covered. You don't want that on video?
You should take it with your iPad too.
Good job, Kayla.
It's on the phone, Kayla.
Now remember, we have to make it back.
I thought you weren't walking today.
I know, when I came in, he said it's too early to start.
You okay?
Keep going. Okay, go to the right. You're still doing it. You're doing great. One foot in front of the other. Keep going. Nice and tall. Those legs nice and strong.
This is good. This is so good.
Good job, Kaila.
Wow.
Whoa, we're fixing
This is
It's like she goes slow and then she gets into overdrive.
yeah.
You do a side kick?
Yeah. We'll go to these double doors, then we'll turn around.
And you're covered.
All right. Can you turn towards Dodie so we don't get you wrapped up in your IV?
This me.
Sorry.
That's okay.
Face, honey.
That's okay.
Kayla, good job.
All right. Deep
There
breath.
we go.
Take your time.
Here, swap.
Sorry, don't want to run over anybody here.
Very good. Try and loosen up your grip on the walker if you can. Good. Get your with it. And take a few steps. And then hand
Wow,
out.
that's just cuts.
She's doing it without the walker.
Hmm.
She's doing it without the walker.
Oh, really?
What? It's just, no, the walker's not, just that card. There we go.
Okay, I gotta get this here.
Check this out.
Yeah, and she doesn't want to, I'm just holding on to you.
Oh my gosh. Wow.
And you're right in here.
That's good.
Right in here.
Yeah.
Okay.
That's amazing.
Proud of her.
I don't even see people leaving without a walker. So I've never seen a patient walk without a walker when they're going home.
Good. Get that butt back. Good job.
Hey, good job. 1 day after surgery.
Walking by myself.
Less than 24 hours after surgery.
I gotta do your fighting sense.
Dr. Chang's patients are going to have a lot to live up to with that performance.
Wow. Okay, so to get back into bed, what we need to work on is doing log rolling, like how we got you out, going onto your side and then moving your body as a unit. So we don't want you to twist and rotate.
Okay.
Okay? So can you scoot your butt back in the bed so you're more in the center? Yep. If you have the right idea, you can shift to the right and scoot your left butt cheek back. Yep. Want one more itch before we lay you down?
Yeah. This is one that itches right here.
And if you want to lay on your side a little bit more to get some pressure relief off of her back, that would probably be good.
Yeah, right here where you're itching is where your drain is. So you really don't want to be tugging on that.
Good job, Kara. Okay, so what we're going to do is we're going to help you lay on your side. So I want you to reach for
It's
the...
more painful than walking.
Yep. Over here, I'm going to help you with your legs.
Slow out.
Stay on your side.
Slow out,
Stay on your side. Good job. Okay, Kayla, now it's one unit. You're going to roll on your back on the count of 3. 1, 2, 3. Roll on your back. Good job. I know. We just have to get you straightened out.
I'm going to fix your head over this way.
Can I see the hands?
Good job, Kaila.
She's a rock star.
Good job.
Thumbs up.
Kayla, do you want your pain button?
Yeah.
Good job.
Kaila, it's day 3. 2 days after the surgery, actually. It's Thursday. How you feeling today?
Okay.
How's the pain level? On a scale of 1 to 10, what would you say your pain is today?
7.
A 7? Okay. Well, that's good. Is it always a 7?
Oh.
Kind of goes in and out, doesn't
You
it?
can get up to a 10.
Yeah.
But I get through it.
Yes, you did. You're very brave.
Great kid, Kayla.
You're inspiration to us all. Get some rest.
Why don't you say what day it is?
Friday, August 8th.
Third day after surgery. You had a rough night and a rough yesterday, but today's getting better.
Very good. It's my 4th post-op day, and I'm feeling a ton better. The 2nd day and the 3rd day after operation are pretty rough, but I'm feeling a lot more up to doing things like walking and eating and sitting, and it's pretty good, actually. I'm surprised how much better I feel after 4 days, so it's good. I'm about a week out from surgery. I've been home for a couple days. I can walk around, but I've been in a lot of pain. It's a painful process, but each day it does feel like it gets a little bit better. I started just walking to the kitchen. Now I can walk almost a lap around the whole house, the bottom stairs. It hurts though. It hurts when I sleep. I can't toss and turn, and I need help to get up, but I need help to use the bathroom and shower, but I'm getting there, and it'll be better next week. Well, tomorrow's 2 weeks out from my surgery, and I can walk on my own, so it's great. I can mostly take showers on my own. I can do pretty much a lot of things on my own now. It's doing really well. Pain is still on and off, you know, but I can dress myself. I can do pretty much everyday tasks, even 2 weeks out from surgery. So we'll see how it goes in 6 weeks. But as of right now, it's going so well. I feel great. So yesterday I actually got my hair done, and I got to sit in a chair for a couple hours, and my back hurt afterward a lot, but it's getting better each and every day, and I'm really excited. I look in the mirror when I wake up every morning, and I see it straight, and I see it's just changed my life completely. It's a great feeling. Tomorrow marks the day 3 weeks out from my surgery, and as you can see, my scar is healing up nicely. It looks great. It looks like it's almost even been a year. That's how nicely done the scar's looking. It's great. Last night was a painful night, and I was tossing and turning all night, but it gets better in the morning as the day goes on. But when night hit, that's when it's a little more difficult. So I'm a little over 3 weeks out from my surgery, and today is a really painful day. Meds aren't helping, sitting isn't helping, nothing's helping, just everything is hurting really bad. It seems like the past couple days it just feels like it's getting worse and worse, but hopefully tomorrow will be a better day. Hi, I'm about 4 weeks out from surgery, and today was definitely one of the rougher mornings. The nights and the mornings are obviously the toughest because you're trying to get comfortable and your back gets stiff and overall it just feels blah. But as the day goes on, I'm starting to feel a lot better as each day comes. I'm starting to be able to do things that I didn't think I'd be able to do as soon. Being only a month out, I can barely run, but at least I can run. I can go upstairs. I can do a lot of things that I'm actually very surprised I can do, especially, you know, only 4 weeks out from surgery. So it's awesome to be able to have my life back and be able to look in the mirror and feel more confident about how I'm sitting up straight and being able to look in the mirror and feel beautiful. It's awesome that not only I can feel beautiful, but I can get back to my life. You know, I can wean off pain medication, I can start to do things without everyone's assistance. I'm starting to become my own person, and not only do I feel better, and I feel like I look better. It's just the total package, and it's phenomenal. I couldn't say I would be doing any better than I am right now. It's only 4 weeks out, and I still have 2 weeks till my post-op appointment, but we'll see how it goes from there. Today I'm 5 weeks out from my surgery, and I'm feeling great. I can do so many more things than I thought I'd be able to. I can walk on treadmills. I'm getting up to running. I am starting to do minimal exercise. I can do things on my own. Like at night I can turn myself and switch myself. I can lift heavier things. I mean, it's great. It's phenomenal. I can get back to doing things I love. Like I can go with my mom to the grocery store without having to ache. And I can go to the movies and sit through a movie without being in pain. I can go on car rides without having to support myself with a pillow behind my back and complaining. I feel like I'm almost back to normal. And a week from today is my post-op appointment, and I'm really excited because he's going to be so happy to see how I'm doing. Dr. Michael Chang did a phenomenal job, and he's going to be thrilled to see his success. Well, tomorrow is my 6-week post-op checkup. This is the last time I'll be doing this documentary. This 6 weeks has been quite a journey. I have gone through some spouts of a lot of pain, and then I've gone through some moments of joy in seeing what I can accomplish and seeing what Dr. Michael Chang did to save basically my life. I was not confident before the surgery, and I had so many limitations due to the back pain. And now I feel confident about the way I look. I feel confident about doing certain activities. It's a great feeling. And I can't wait to share that with him at the post-op appointment tomorrow. It's been crazy. One week you feel great, one week you don't, but now that I'm getting to the conclusion of the general pain, I'm 6 weeks out from surgery and I feel great. And hopefully tomorrow Dr. Chang says I can resume my life. Hopefully I can resume activities like going back to the gym, trying to do running, just running. That'd be great, just to be able to do that without excruciating pain in my back. And resume my life. It's a great miracle and a great blessing that I was gifted with, that Dr. Chang could fix my back and save my life. And I could be more thankful for what he's done for me. And just don't know what to say. But thanks.
So, how are you feeling now that you're 6 weeks out?
It was a challenge.
Right?
Most definitely.
It's pretty rough the first 6 weeks.
Yeah,
Is it getting better now?
it is. Just
Okay.
some muscle difficulties.
Yeah.
Just muscle pain.
Like we talked about, it's actually going to be 3 to 6 months before everything completely settles down.
Mm-hmm.
But I'm glad to see that it's better now than it was the first couple.
Yeah, the scar's feeling up really
Yeah,
nice.
you should see. We were so impressed with how it looks.
Yeah,
I mean, even
amazing.
such a short time after, we're not talking 6 weeks, we're talking, I don't know, just
3
the look of it, how it
Scalp
scaled
started to come
so
off.
beautifully.
Well, let's take a look.
I just can't believe it.
Good. Yes, you're healing that quite nicely. And as you can see, her back is corrected now, right?
So beautiful.
Yeah.
We're so happy and we thank you so much.
Yes, thank you.
Well, have you had a chance to look at yourself in the mirror? Your
Yeah.
back? Good,
Yeah, I've
good.
looked at it.
Good. So,
What do you mean? She's like all the time looking. Kayla, come on out, honey.
well, you have you had a chance to see your x-rays yet? We can show them to you. They're on the computer outside, but essentially it will show that, the hump that you had before is completely taken out, and you have a normal appearance as far as the curve in the chest region of your spine. But again, you probably didn't need an x-ray to tell you that. So
Do you know how
that-
many degrees it is now?
It is now, it's difficult to measure exactly, but now it's in about the 40-degree range, which is completely normal.
About half, literally half.
Yeah.
What it was.
Which is exactly what you want it to be. If you correct more than half, sometimes the body can't tolerate it very well. But I think you're going to do great from this.
Yeah.
Well, do you have any questions for me?
I'm having a lot of pain behind my shoulder blades.
That's right.
That's just the main.
That's completely
it's
normal.
constant.
Yeah, between your shoulder blades, so the upper portion of the incision.
And
Correct.
almost like behind it.
Yes. That is normal because the screws and rods kind of hold your spine together, but they don't secure your shoulders. Your shoulders are free floating compared to your rib cage and your spine. The only thing that attaches them are those muscles in the back that you're feeling. So when you fuse the spine and correct that, that hurts for 2 reasons. One is because I split those muscles and they're still in the process of healing. And 2, they can still move, right? So it doesn't hurt down here because even though I split those muscles, the screws and rods hold everything together so they don't even need to move anymore. So you're constantly resting those muscles. Because you're still actively using your arms, you're constantly pulling the muscles that are trying to heal in that region. The bottom line is that's normal. It's the last thing to get better. And it can take up to a year for it to become 100%, but most people are good enough to do athletics. Like it only bothers them a little bit by about 3 months out. So.
Yeah, that's our biggest question. We don't want to treat her like this little China doll, but we don't want her to do anything that's gonna mess anything up, and I'm thinking, are one of those screws gonna pop out? I mean,
No, the screws are.
how sensitive? I know you said last time that
And she was
she's gonna have a
afraid my
stronger
screws were gonna
spine
pop
than
out.
most people
Yes.
because of it, but
Yes, so at this point, your spine is still in the process of healing, so it has not reached its full strength, but it is not delicate at 6 weeks. You could definitely do any activity other than sports, so like no tumbling, no physically running into other people or jumping up and down, but if you wanted to walk around, walk upstairs, you know, do all those things, you can do all of that.
Running?
Running, I would prefer you not do for another month or so. It's the theoretical risk of running is actually pretty low. It's jarring, you know, when you run, and that's what concerns me more than anything else. That it would cause a muscle injury or cause this back pain to hurt a lot more. It's not that.
Just walking or faster walking?
Faster walking is fine. Elliptical is fine if you need more exercises or Stairmaster or something of that sort.
What about lifting? What's the...
So at this time, I would say that you should limit yourself to about 20 pounds or less. Again, it's not because I'm worried about the screws and rods. I'm mainly worried about the fact that if you lift too much, you're going to strain the muscles between your shoulders even further, and that's going to cause it to take a lot longer before it stops hurting.
So as far as going to the gym, I should just keep it on the...
because she's so active
I go to
that
the
she
gym
might
a
hear
lot.
one thing and we might hear something
right.
else. We need
So-
to make
so
it
the
really clear about what she can
Yeah,
do.
so the easy way to do this is to say, for another 6 weeks, you just should not do any sports whatsoever. If you want to be technical about it, at 6 weeks, there's some things you can do. You can swim now, okay? You can,
Submerged in water?
yeah,
If she
submerged in
wants
water, so you can have a bath, you can swim. You can do elliptical, you can bike, and you can do Stairmaster, but nothing jarring. So running is
That's what
jarring,
I'm saying, the
no
Stair-
jumping,
the Stairmaster
things
at
like
the
that.
gym.
Yeah.
Just
And
on
And
the-
no weight, yes, no weight training.
Yeah.
So
That's fine.
all of those
Cardio
will
is
come
more concerned.
in another 6 weeks. You can do all of those things. But for now,
Just keep it to the
Yes.
cardio kind of thing.
yeah, because it'll take you about 3 months for everything to set.
Well, that's good news. I can do the bike and I can do the other.
And there's a Taekwondo tournament in the middle of November.
15.
And they asked her to be a referee in this tournament. She's not in the contact, but she'll be moving around quite a bit.
A lot of arm movements, you know, a lot of scoring.
I'm sorry, when was that?
November 15th.
Yeah, you'll be absolutely
Ready,
fine
yeah.
by then.
Okay.
By then you could spar in Taekwondo, but you just can't compete in Taekwondo. So
Okay. Well, that answers that.
Well, hopefully when we get down, when we go to Tucson, I can see the martial arts school. That'll be by January. I'll be good by January to do activities.
oh, absolutely. By January, you'll have no limitations whatsoever.
Wow.
Really? Okay.
That's incredible.
So grappling would even be okay?
That'd be fine. Skydiving, whatever,
Motocross.
you know, motocross, yeah, exactly.
So we don't have to worry about we're doing something that's going to jar, or I mean,
Not in the future.
I'm thinking that. Okay, I'm sorry.
After about 3 months, your spine will become stronger than
So
the
at 3
average
months.
individuals. So
So at 3 months, I'm not saying all in 3 months I'll be able to grapple, but by 3 months that'll be the time when I can start doing
yes,
sports.
that's yes. At 3 months, you can start doing
Kicking.
sports. Although we like you to ease into it. That's why we say no competitive sports for, you know, until about month 4
Kicking
or
won't
5.
do anything because it's, you know,
Yeah,
twisted.
kicking won't do anything, twisting, bending, by that time it won't do anything. But you shouldn't do those things now, mainly because they would potentially injure your back muscle.
So I shouldn't be bending down or twisting at all at this point.
That's right. I mean, you can't avoid doing some of that, but you want to be as gentle as possible.
Mhm.
Okay.
She's been on me about that.
Mike, don't
Twist.
Good.
It feels natural, like when something falls.
I know,
You squat
it's-
and then you bend.
Yeah.
She had a question regarding childbearing. Is there anything that would limitate her?
No. The levels of fusions that you have do not affect childbirth at all.
Okay.
The only concerns in regards to childbirth are, you know, there's theoretically a possibility that your kids have a slightly higher risk than normal of developing similar problem, but still statistically they're more likely to be just fine.
When you say the problem, like
Yeah, kyphosis or kyphoscoliosis or something of that sort. But again, that doesn't affect the childbearing process at all. You know, the thinking about that was based on older types of fusions that we did in a different population. And also we, at that point, we fused the pelvis, and if you do that, then a lot of times the women have to have a C-section. They can no longer deliver naturally, but you won't even have that problem.
Okay, got it. That was-
Yours doesn't go down that far.
Yeah, yours doesn't go down nearly far enough to impact that. And in fact, long term, you should have no limitations of anything that you do.
Perfect.
Scar looks great.
Yes, you healed that well.
Yeah, you know, we are just so indebted to you. Thank you. I
Well,
mean, really,
you've
honestly.
made me lose sleep because I tried to figure out something to thank you with, and I'm very creative. I can't think of anything
I'll
except
figure it
just to
out.
say thank you so much.
Well,
Yeah.
it's definitely my pleasure. I'm glad to have been able to help you out with this.
Yeah,
So
thank
thank
you
you.
so much.
It's my pleasure. I'm glad you're doing so well.
Thank you.
You want to see those x-rays?
Yes.
When did she need to?
Come back.
Do you have one more question? See you, and then is there something she should look out for if? I mean, it's just basically going to be muscle pain for her if she does a little too much, or is there something that we should be looking out for?
So you, as long as you don't have really severe pain, you're okay. That's kind of, pain is your kind of guide.
Okay.
It will be a little bit uncomfortable with certain activities. So if it's like what you're experiencing, the shoulder pain, that's fine. The key is that you should be getting better, not necessarily on a day-to-day basis, because you'll have good days and bad days always, but on a week-to-week basis, that you're getting better. As long as that's the case, you don't have to worry about it. You're far enough out that's unlikely that, it's increasingly unlikely that you'll get infected or anything like that, but always look out if your wound starts opening up, draining, if you have high fevers or
Well, I didn't really know if I wanted her to go into the jacuzzi at the gym because I was concerned about that, or should I not be?
So, you're right to be concerned.
Yeah.
I'm concerned about that
Yeah.
too, but that's why we don't let you do that for the first 6 weeks. At 6 weeks, it doesn't make a difference.
Okay, so I shouldn't be concerned anymore.
Yeah, because
It's not
now,
cool to have at the gym.
yeah, your incision is well healed enough that you're essentially waterproof.
Okay.
And I don't need physical therapy or anything?
No, not
So you
unless
go
you
into the
feel,
gym?
yes, since you've been active yourself, you don't need that. If you said, well, I've kind of just been, you know, at home and not doing very much, I wouldn't be opposed to physical therapy. But since you're young, usually you can just rehab yourself. If you think that you want some pointers at any time, just give me a call. I'll send you to physical.
Nights are the only thing that are really rough.
Yes, that's typically the case. And then about 2 months from now, I would expect it to be, most of it's all okay all the time, but every now and then you'll have this random spasm between your shoulder blades, and that would be completely normal.
Should we have her still be we want to get her off things obviously as soon as possible, but does she need to still take Valium to help with, or because she's taking the hydrocodone?
We're
So-
trying to go longer on medication. and
We're
it's
trying
just not.
We're trying to go longer.
You want
but
to,
she
so
still
of the two,
hurts.
I think it'd probably be better to wean off of the Vicodin rather than Valium. Because I wouldn't stop both of them at the same time, because that might be too much.
Okay.
I've tried one pill and it's
Yeah.
no.
Yeah,
So-
she's in the hydrocodone and the Valium right now.
Right.
Right.
So that's fine. You do want to space it out, but
Right now
Just
it's
pretty
past 4 hours.
Yeah.
We've tried to go 5 or 6 hours and it's just not there yet. Is that something that's okay?
that's fine. Are you taking 1 or 2 pills?
I take 2.
Okay. The other possibility is instead of spacing it out longer, you just lower the dose.
Like 1.5
So,
or 1.
yeah, say take every 4 hours you take 1 or 1.5. Okay, that would be functionally the same, but it would feel better because maybe you don't need that much pain relief, but you need it on a more frequent basis, and that would help you out.
Well, everyone's different, but what do you see with most patients? Are they tapering off at 2 months, 3 months, 6 weeks?
Usually start tapering off. So you're appropriate in that by the time they see me at 6 weeks, they're no longer on Percocet or the really heavy hitting
Yeah.
drugs. Before 3 months, they're usually completely off. So
Okay.
before you see me again,
So that was my.
Yeah, about half of them will still be on some amount of Vicodin at the 6 weeks visit, so that's fine. Just, you want the target to be for the next 6 weeks that you gradually come off of
Yeah, she's on
everything.
the hydrocodone now, and then we're trying to space it out, but we just don't want her to be in.
Yeah, instead of spacing it out, why don't you just lower the dose? It's fine to take just one pill.
Okay.
So what you can do is take one pill of the Norco or the hydrocodone, and then the other pill you can take extra strength Tylenol, right? So then functionally you're getting the same
Oh,
amount
so
of
you can
Tylenol,
say, yeah.
all you're doing is decreasing the amount of narcotics, which
Take
is
one
what.
Tylenol, 100.
Yeah.
And about
And see how that goes, and if that goes well, then you can try, maybe taking
just
away.
Tylenol.
Yeah, just Tylenol.
You were gonna ask about a muscle relaxer.
Well, I was going to ask how long does she need to be off of the ibuprofen?
3 months.
3 months, okay.
Didn't you want to ask about a muscle relaxer?
No.
Valium serves as your muscle
Yeah.
relaxer. Yeah.
Okay.
So 3 months, that's our last question. He's like, see her in 3 months, right?
Well, not 3 months from now, 3 months from surgery,
Yeah,
so
yeah.
another 6 weeks or
Okay.
so.
Okay. Yeah, I said that wrong. Okay.
All right.
Do you have any more?
I can't think of anything, can you?
Thank you.
Yeah, thank you very much.
It's my pleasure. I'm glad you're doing so well.
Thank you.
All right, come on, let's go. That's to make sure that the x-rays are on the same rotation every time we take it. So this is your spine before, and as you can see, it's quite hooked through this region, right? And this is your spine now. So as you can see, this is all strained down.
Unbelievable.
Yeah. It's awesome.
So good. Thank you, thank you.
That's great. Can I see the straight on?
You want it straight on?
Oh, there it is, right there.
Here, this is the bigger view, your entire body. So that's completely straight. As you can see.
Amazing. Oh, one more question.
Sure.
Sometimes I can't take a really big deep breath. Is that normal?
That's normal.
Because it hurts really bad to take.
Yeah, because the fact that it hurts when you take a deep breath means it's muscular. Your muscles were used to be in a certain position, and essentially over the course of a couple hours, I just straightened it out, right? So it's like a rubber band that's pulled taut. It takes time for it to grow and get used to its new length.
So like coughing and breathing in and sneezing, that's normal?
Yes, that's normal to hurt.
Okay. When should I expect that to be? 3 months?
Might be a little bit longer than 3 months for coughing and sneezing. You'll get better by 3 months.
Mm-hmm.